Well, you don't plan for trauma, it just happens. That's what the director of trauma, Dr. Dennis Ashley, said at the first ever Trauma Survivor Network.
41 NBC's Amber Lake attended the ice cream social to listen to the stories of trauma survivors. Amber.
Dr. Ashley says the first ever trauma network in Central Georgia gives patients and staff a chance to reconnect.
I couldn't even remember my family's names. I couldn't even, I was very unaware.
3 trauma survivors shared their stories with other survivors and the doctors who saved their lives.
I was so vulnerable. And some of the nurses here, there were 3 specific, brought a white little teddy bear to me, and that meant a lot to me.
Seeing them back in society and functional, it really pumps us up to make us ready for the next patient.
Dr. Benji Christie is a trauma surgeon and has helped many patients during his 9 years with Navicent Health. He says that being able to hear the stories of the patients he's helped and see how well they're doing is heartwarming.
I don't know, this very real, emotional reminder of what's at the end of everything that they have to go through and what makes kind of doing this job so worthwhile.
Trauma Survivor Day offers survivors and their doctors a chance to interact and offer advice.
Nobody plans for this, nobody chooses a traumatic event or an accident, so the path is unknown.
Because when people look at me, they think there's nothing wrong with me, but that's because they don't see it.
All 3 speakers at the Trauma Social say that if you've experienced a trauma, talk to someone.
And so it's never as bad as it seems as the time you're going through it. Just hang in there. There's a brighter day coming.
And there are a lot of resources offered to trauma survivors. One of them, like Rouse suggests, is talking to others who have experienced a traumatic experience.
Thank you, Amber. And there is also a website that can help. Just head to traumasurvivorsnetwork.org.